And of course, as we're talking about temperatures on the rise this week, it means a lot more people are going to spend a lot of their time outside.
But there are some concerns this morning over the West Nile virus.
Understandably.
Especially for folks like me.
Yeah, alive.
I have like sweet blood or something. This is as Colorado saw its first human case of West Nile virus. It was confirmed in Arapahoe County. To help explain what this virus is and how to protect yourself is our 9 Health expert, Dr. Pyle Coley. Thanks for coming in.
Good morning.
So this is really scary. Talk to us a little bit about West Nile virus and how common it is and how it spreads.
Yeah, it's been around in Colorado since 2002. We've had cases every year. And really the highest risk periods are when the mosquitoes are active. So June through September, the summer months. And when mosquitoes are most active around dawn and around dusk. So that's the time when you want to worry the most. We've actually had deaths every year from West Nile virus. In 2022, we had 20 Coloradans that died from it.
Wow.
So the way that it spreads, it doesn't usually go person to person, although it can through blood transfusions or from mom to baby. But really, the mosquito goes and bites an infected bird, and then it can spread it to other birds, or it can bite the human and spread it to humans.
Okay, so who is at risk for infection with West Nile virus?
Anyone.
Okay.
Anyone who lives in Colorado or areas where there are, mosquitoes that have West Nile virus. If you work outside, you're at higher risk, obviously. If you live near areas where there's standing water, so I'm thinking about the mountains or areas where we have bodies of water, even actually your plants, if you tend to water them and have standing water there, that attracts the mosquitoes that can put you at risk.
Well, and I know you and your family like to go out on the reservoirs.
Yes, and
Yeah.
I feel like I am at such a higher risk here because I will go camping and I'll get 22 mosquito bites and my husband will get 2.
Yeah.
It's so weird. So how do you know if you have West Nile virus?
Yeah, it's interesting. There's actually a genetic predisposition to who the mosquitoes will bite.
Lovely.
So if you have identical twins,
You can blame your family. Yeah. You have identical twins, though.
the mosquitoes bite them at sort of a similar rate. So that's kind of interesting. So Corey and I think, both have genetic predispositions because I have the same problem. So most people, thankfully, won't have symptoms, even after the mosquito bite. So 75 to 80% no symptoms at all. The 20% that get symptoms will be like flu-like symptoms, muscle aches, headaches, fever, sore throat, and usually happens 2 to 14 days after. So if you go camping, Corey, and a couple of days later or a couple of weeks later, you're noticing some of those symptoms, it probably makes sense for you to talk to your doctor about West Nile.
14 days, that's a long time to wait till you're out of the clear for that.
It can be, yep. And very few people, thankfully, progress to severe life-threatening symptoms, but the ones that are chronically ill, so our elderly patients, our young kids, people with chronic illnesses like cancer or heart disease or smoking can actually get neurological involvement, which can lead to death.
If you are kind of maybe, thinking you feel some of these symptoms, is there a test that you can take to see if you have the virus?
There is a test, but you can't take it at home. So your doctor would have to order
Okay.
the test, which is why you should probably reach out to your doctor to discuss this.
How can we prevent it from
Yeah,
happening?
truly.
It's important. So there's no vaccine, unfortunately. There is a vaccine for horses, but not for humans. They may make one for humans eventually. They say if you've had it once, you may be protected for life, although we don't yet know how long that immunity lasts. But the best way to protect yourself, June through September, use those mosquito repellents with DEET. Use those candles outside that smell nice. That can also repel the mosquitoes. Try to avoid being outside dawn to dusk, because that's kind of when, in dawn and dusk, when the mosquitoes are really biting.
Yeah.
And just try to make sure you keep yourself covered up if you are going to sit out.
And watch for any standing water in your yards. If you can clear that out, that's
very, very, very true.
We watched a movie outside this week at like dusk, and I had like all the layers on. I had like the bands on, all the ankles and
You
wrists.
had a net around yourself.
Citronella candles all around me. Yes.
Did it work?
I still got a bug bite.
You basically went down Dr. Coley's list and did everything she said not to do, right?
They will find a way,
They
let
will
me tell
find
you.
Dr. Coley.
Thank you.
All right, you can find all of Dr. Coley's appearances at 9news.com/Dr. Coley. Let's get check your forecast.